Hello, my name is Sally Nichols. Thank you for taking your time to assess me today. Here is my ID card, and I have my pen ready, and let's go. So, Mr. Roy Chapman is a 75-year-old male who came in post 4 days ago, post-fall. So, my 3 priorities of care for Mr. Chapman would be hydration. I think that he is very dehydrated. That can be shown via the decrease in blood pressure, the flushed face, the dry lips, the headache and the dizziness can also be a part of that. So I would like to get him rehydrated as soon as possible. So my second priority of care would be pain relief. When I walked into the room, he appeared quite distressed, and he said that he was very dizzy and had a headache. By giving him some pain relief, hopefully that some PRN pain relief, hopefully by then by doing so he would be able to feel better about and be able to interact more with his care. And the third priority of care is helping him move, motivating him to move. He has significant injuries on his right side of the body. However, if he continues to stay in bed with only getting out of bed for the physio, he will likely be at risk for pressure injuries. So those are my 3 priorities of care. Okay, now I will talk through one of these priorities of care in detail of how I'm going to with the hydration. I would first off make sure that his sedation status, assess his sedation status, whether it has been shown at 7 o'clock that he has a mild sedation status, so he may be at risk for asphyxiation. So that is something to contend with. If he is unable to have fluids orally, I would contact the RMO for him or her to be able to chart IV therapy for Mr. Chapman so that he can get fluids that way, and it'll be very much quicker. Okay. How would I communicate one of my priorities to another health professional? Alright, I would say, hello, I'm Sally Nichols. I'm a nurse looking after Mr. Roy Chapman in ward, room and bed. I have observed that Mr. Chapman has dropping blood pressure. He has a mild sedation status and a respiratory rate is rising, while this inspiration of oxygen is dropping. He's 75 years old with no underlying medical conditions. He has come in via post-fall from his home 4 days ago with fractures in his tibia, pumurami, and has a periorbital contusion and contusions on the right side of his body. My assessment is that Mr. Roy Chapman is dehydrated, and I recommend IV fluids to help stabilize this patient. Thank you. Please let me know what your thoughts are and how close. Is there anything that you would like me to do as a nurse to better assist you in helping us look after the patient? That is how I would have a video face-to-face or on the phone convergence of information with the other allied staff. Okay, so that would be what I would do to escalate the care, because if his urine output was very dark and smelly, so it is very highly likely that he is dehydrated. Okay, how would I engage Roy in his care? Well, first off, with priority 1, barring the assessment where he's able to take liquid orally, I would encourage him to drink more fluids. I would ask him, oh, what's your favourite drinks? What is your favourite drinks? Like, would you like a cup of tea? Would you like a cup of tea? Would you like milk? Would you like juice? What are your preferences? How can I help you gain more fluids? With the second priority, the priority of pain relief, I can ask him whereabouts in the pain. Is it just in the head, or is it in any other parts of the right side of the body that you're feeling pain? Which will then give me more information to help him maneuver. I can encourage movement. I can say, look, I know that you are not feeling the best right now, but I think it is good to keep moving about, even if it's only little things. If you are feeling unconfident to move about out of bed, that is fine. I can give you some exercises so that you can move your body, like that you can do several times a day to move your body so that you won't get pressure sores. And that way you won't have any new injuries occurring while you're in hospital, and you can get home to your cats quicker. So, with those 3 things, that's how I would engage Roy in his care. I would also, another way of getting him to move is I would ask him to perhaps practice moving in ways that he can look after his cats. So it's not just, I have to get over this obstacle that I have right at the moment. It's like, I have an end goal in sight of being able to go home and look after my cats. So being able to move about in a productive way and a safe way would be really good. It would also help me in assessing his mobility needs. How would I ensure that I'm supportive of Roy's diverse background? I would talk to him. I would talk to him about what he likes, what he dislikes, if there's any way that I can help him feel more comfortable in this environment. Thank you very much for your time. Bye.